Bismillahirrahmanirrahim. I am Dr. Raza Mohyuddin, presently member of the teaching faculty in MPH, Times University, Multan. So today is the first part of our subject, health care system analysis, and then today I will give you a brief description of health systems and how it works, what are the functions of different healthcare systems. As you already know what's health, this has been defined many times during the course of your study. As you know, health is the physical, mental, spiritual and social well-being. All the 4 or 5 dimensions of health are covered into it. It is the well-being of all that dimensions. And now the health is a basic, to be healthy is the basic right of all the human beings. It is their prerogative to be healthy, and the governments, the communities, their state is bound to, this is their duty to be, and commitment to provide the healthcare facilities to the public. And the very important is that all the different governments and states, the nations have their healthcare systems, although the policy is different and that systems work in a different way. Now we see what is a health system or a healthcare system. This health system, sometimes it's referred to as a healthcare system. It is the organization of people, institutions and resources that deliver healthcare services to meet the health needs of the target populations. And the WHO has also defined the healthcare system. In this definition is that healthcare system consists of all organizations, people and actions whose primary intent is to promote, restore or maintain health. So this includes effort to influence determinants of health as well as more direct health improving activities. So the health system consists of all the stakeholders of health, the organizations, the people, the health facilities, their work, their technology and their day-to-day function. And of course, that on the top of the list is the health policy. So this regards the definition of healthcare system. Now, the different healthcare systems, they exist in this universe. So in the world, there are certain models of healthcare system. The Bismarck Model is in Germany, Japan, Switzerland, Belgium. These are the private health insurance plans and the people are benefited by them. And this is not, there is a tight government control over it. The Beveridge model is in UK, Italy and Spain, and it is the healthcare services are being financed by the government but it is financed through taxes of the people. And there is the treatment is considered the public bills. So it is, there is service-like position. Then is there are the national health insurance models. They're like in Canada, South Korea, and it is combined of Bismarck and Beverages, and provided the providers are private, but the payer is the government through insurance schemes. And as this Beverage, as the word indicates, that is in England, it is the government has a tight control over all that. So you have to go to the clinics which are prescribed by the government, and funding and billing is done by the government. Then is the out-of-pocket model, as you see, are private hospitals and private clinics, and they are, the people you just pay and you get the relief. and you pay for the services, whether they are diagnostic, whether they are cure services. Then is an American model. So this American model is a complex one. For different age groups, it is different. For veterans and for their employees, they have a different policy, and for the private, but that is all through insurances. And the hospitals are being run by the private people. And now in the end, in Pakistan, we do have a very good public health system run by the government, especially the primary health care, as all you know, that the immunization schemes, and the private sector is not involved in these activities. This immunizations and the primary level care is a very nice and wide public health system, but it lacks with the tertiary systems because we don't have enough hospitals required for the demands of the people. And that is also the share of that tertiary health care, that the secondary health care is done by the out-of-pocket or to private hospitals. But still our number in the debt is so that that's why our indicators of health, we are very below on that, right, 150 or 160 positions. So there are certain indicators of health. There's a wide range of indicators which we will study later on, which indicate at what level of healthcare system we are. Now, and also in our healthcare system, there is great involvement of local system like hakims and traditional village clinics, and of course the homeopathic and peers and all that. They provide the spiritual treatment, dargahs and all that, religious activities. So that also contribute towards the system. So we have learned the definition of health system, and now we will see what are the providers in the healthcare system. The providers are the institutions or individuals providing healthcare services. Say the hospitals, the doctors, the nurses, all the systems, they come under the head of providers. We are providers, and these are there is no distribution. All the one who is involved, right from the top to the bottom, the management staff, the clinical staff, the paramedics, they are the providers, and they may also work outside of direct patient, such as in government health department of the agency, medical laboratory, or health training institutions. The doctors are the paramedics working in the teaching teaching institutions for teaching, and the people working in the laboratory, they also are called providers. So how these health systems are being resourced. So the financial resources there are 5 primary methods of funding health systems. First is the taxation to the state, country or municipality, what the provincial, local or the federal government obtains taxes from the direct or indirect taxes from the people, they are contributed to the budget for the health system. Then are the national health insurances, which are not so popular in Pakistan. Health insurance systems have been started, the cards, etc. are given in the last 2 governments, but they were not fruitful. Still, there seems to be, not, you can say fruitful. Then is the voluntary or private health insurance. There are certain bodies who provide the private insurance, and with that payment you can go to. That is out-of-pocket model. Then is direct out-of-pocket payments. You are sick, you go to a clinic, you go to a hospital, you go to a laboratory, and you pay and you get the treatment or health care. And then is the donations to the charities. There are certain charitable hospitals, and they have got their own funding agencies like Aga Khan or Shaukat Khanum Hospital. They're full charitable, partially charitable. There are certain community hospitals, they're free for that, and you can get free, or the specific community can get the healthcare services. So these are the 5 financial resources: government through taxes, the national health insurance, voluntary or private health insurance, then is the out-of-pocket, and the donations to the charities. Then there are payment models, that is free for service arrangements, capitation and salary arrangements. These are, all you are aware of this. Salary is the salaries paid to the staff. The capitation are the fees in UK. The fees are paid to the GPs. So that is, there is a cap, there is a system, we examine the patient, they get the fees. Then free for service means they are general practitioners based on service, that they are even more widely used for specialties working in the ambulatory care. Then information sources and health informatics. The use of health information lies at the root of evidence-based policy. So we will study all these in detail later on. And then there is a health management system. It is also part of this, or these sets of policies and plans, and that regarding finances, pharmaceuticals, human resources, and public health. And it is the public health, it is divided typically into epidemiology, biostatics, and health services. Then there are terms inputs, throughputs, and outputs. As this healthcare is a system, so input is any information added into system from the environment, and in this is the inputs are those which are the resources and the patients and the attendants which come to the system for that. Throughput is those changes made to the input by the system, like definitely energy systems and all that. And output, of course, is the output of the hospitals, is the product, and that is the cure and care, and which crosses boundary back into environment, that is our goodwill, that is the commitment. So the inputs are the resources needed to carry out a process or provide a service. So inputs are usually financial. There are the budgets of the health facilities or budgets of the laboratories or clinics. Then these inputs are the infrastructure, the buildings of the health facilities, the supplies, equipment. Like have you see, there is now in Corona days, there is a threat to the even the health status of the doctors and paramedics, because the proper inputs are not provided. The protective equipment is not provided to the doctors. That's why there is a gap in the supply of the inputs. So inputs are required for a healthcare system. You will put something inside and then you can get the results. So building, supplies, equipment, then are the human beings. These are also the clients of the patients are also the inputs. For a running of the healthcare system, you must have the patients. If there are no patients in the hospital, there is no system. Then resources, of course, some people, man, material, money. This is 3M is very important. And now another resource is also, it is the skill. You have the personals, you have the money, you have the materials like equipment, all that, but there must be enough skill for that. If you have ventilators with you and nobody is expert for that ventilator operation, so the system will not work. Then there are, as healthcare system, is not even the just healthcare delivery system, but other systems like the pharmaceutical industry and all that. These are also for that system. The inputs are different. Then our inputs are the set of resources that are raw materials used in the program, finances, and then are the policies in that and facilities. So these are the inputs, and all of these are all important at their place. Throughput, this you transform this input into some product and service. You have got money, human resources, your equipment, and you perform it. You have, like you do X-ray, you perform ultrasound, you treat a patient, you examine a patient. That is your, this input transformation is throughput. The process by which the energy input is transformed into a usable product or output, which is in this case. So then are the outputs. The outcomes are byproducts of the system's activity that are returned to the environment. The goods or services that a system produces. So main healthcare system delivery or service is the main input, and then there are the specific results, and these are also the end results of the organization efforts for which all this healthcare system is made, is to just to restore the mental, physical, spiritual, social health of the public. Then this is healthcare system model. This health for all model is this health needs. It contains the inputs, financing, human resources, public, private, all this makes. Then are the process, organization, government resources, then outputs, health service utilization, and outcomes is either it is morbidity, mortality, and quality of life. And all this are influenced by environment, this system, then you will see the diagram, and then you can see the health needs. They also affect the outcomes, and this environment influences all these inputs, processes, output, and these outcomes. And this political, social, and cultural values, they influence all these four. Now we will, just come in little bit. This was a brief introduction, and now we will see. We have learned the definition of healthcare system, the organizations, institutions, and resources that are devoted to producing health actions. So this is the infrastructure, the people, and the actions. This is healthcare system definition, WH. Then it is, in this definition you see all range of players engaged in just one thing. They are providing and financing the health services, and this include public hospitals, non-profit, and the profit or private sector, as well as the international and bilateral donors. So if we don't mention the international and national donors, the story will not be completed. So WHO, being father of all the health activities, gives guidance, provide the services, guidelines, and so many you will see the activities, also arrange the funding and guidelines as well. So all these combined efforts are towards for healthcare system delivery. So it is healthcare systems encompasses all levels. There is central level, federal level, regional level, district level, community, and household. So in all these places, their health system exists, and these projects, they are engaged in all level of elements to provide the healthcare system. Now we see what are the health system functions. what are the different functions, how we outline these health system functions. As per World Health Report 2000, there are 5 key functions of the health system. The first one is a stewardship, often referred to as the governance and oversight. The body sitting on the top, the federal government or now the provincial government, being the, in Pakistan I say, being the responsible for healthcare delivery, is responsible for this governance and oversight, making policies, giving the guidelines, this controlling the epidemics, giving the guideline, all this. So this is stewardship. The second is financing. You know, money makes the mayor go. No, nothing can be achieved without financing. And then are the human and physical resources, and we have already discussed, and the fourth one is the organization and management of service delivery. So we will see the relationship between the 4 functions of this healthcare system.